All right. Welcome, everyone, to our Unit 1 Zoom session, our first Zoom session for this course. So I'm Dr. L. You have my intro within the course, but a little bit about me. Currently, right now, I am a research scientist for a in vitro diagnostic company. I work within the medical division. I do a lot within public health, population health management, organizing clinical studies within our devices, organizing clinical studies, within certain fields that we have interest in, diabetes management, say lipid care, chronic disease, heart disease, even within certain disease states. From me within the research sector, as well as within the public health sector, those things, combined. I've had experience with a great deal within the public health sector, which is a very, very key aspect for me. So, excuse me. And the clear back throat here, I have a little bit of seasonal allergies here, so I do apologize. Within this course, we're going to look at a lot of different factors within public health. Public health is a very dynamic field. It's a field that is evolving, just as healthcare evolves. Public health is evolving at an immense rate. For myself, it's one of the key areas that I just love. It's one of those interesting areas that has a lot of key information and really connects a lot of different healthcare sources, and it's kind of a research practice mechanism of healthcare. For me within this course, I am available pretty much 14 to 16 hours out of the day. I do have to sleep, unfortunately. My job wears me a little thin. You can probably tell by the bags underneath my eyes here today. When you reach out to me, I'm very open. I have an open door policy. You have my number listed within the course. You can always give me a call or text me. Probably respond faster to text is simply because I can respond to text within meetings and things like that rather easily. It's hard to answer a phone call if I'm in a meeting with my bosses, but it's very easy to act like I'm answering an email for someone within the company when I'm actually helping you with an assignment. So don't tell them. So we'll keep that between us. Also, too, the first line communication is always going to be email. My email goes straight to my phone, so I will respond to that fast as well, too. You'll probably see various notifications from me. I have an app called Dial My Calls. I use that to send out kind of text messages and recorded calls just to remind you of certain key things within the course that week. I may also do some polls where you get a call from my actual number and ask you a question of, what is the topic that you're struggling with this week? Is it A, B, C, or D? I get those responses in real time. That then allows me to maybe make some mini Zoom sessions on some certain topics to kind of help you guys get on track, or maybe help you a little bit within something that may seem muddy, or something you just maybe the class just doesn't understand from the readings or from what we've covered. So I try to be involved as much involved as I can with the online forum. We can arrange conference calls, we can arrange Zooms, whatever I can do to help you within the course. I'm here to support you as much as I can. Looking at the introductions, you guys have an immense amount of experience. You bring a wealth of knowledge and experience to the course room. I always learn from you guys as well, which is the great thing about teaching is I'm not only, sharing the knowledge and experience that I have, as well as my knowledge on the topics in course, but I'm gaining knowledge from you guys. You guys have a wealth of knowledge and experience from your many years within the healthcare sector or the other sectors that you're coming from. And that is part of learning and part of the process is sharing knowledge. It's a big part of public health is sharing knowledge and information. So we're going to explore that throughout this unit. and throughout the course. Now, excuse me, I'm going to share my screen here. Let me bring that up. There we go. Move this out of the way. Now, we look at this. Our first discussion. First discussion is on the future of public health. I posted a great little video with the announcements that is unique. It takes a stance in terms of public health in 2030. You know, looking at the future and what it does, and it pulls in a lot of the things that are just starting now in terms of, you know, things like wearable technology and what it's done for public health and how it's improved things and how they're expanding upon it. It's a very unique little video. It's done very, very cleverly, and you know, when you watch it, you're like, oh, they're building upon this trend right now, which is a great thing. It's a great little snapshot. That's kind of what we're looking at here, and some of those you know, challenges of how do we get to that 2030 prediction? How do we get to that whole epitome of you know, public health in the future? How do we get there and make it a great future within public health? And a lot of this discussion kind of addresses that. So we're looking at, we're reading the following articles. So it's an article from the NCBI at the NIH, which is a government website, the National Institutes for Health. Great source. This is on Patient Protection and Affordable Care Act. So you're going to look through that. And you're going to answer these key things. What are some of the challenging issues related to creating and coordinating and collaborative public health system within the passage of the Affordable Care Act? What advantages do you see in the domain of public health now that that ACA has been passed? What challenges do you see in the domain of the public health now that ACA has been passed? Why is it difficult to manage public health at the local, state, and federal levels? If you haven't looked at this little snippet, it's about 5 minutes long, I think. Actually, I think it's 4 minutes and 17 seconds to be exact, if you want to be precise. It actually delves into a little bit of these. This is why I looked and posted this one, because I'd seen it a few weeks ago. And it's kind of like, oh, yeah, that's neat. And when I was preparing the shelf for this class, I was like, hey, you know what, this needs to be posted. Because it hits that Unit 1 discussion very well. And it hits those aspects, and it gets you really thinking in terms of, you know, it looks at it from the impact, while it talks about it very briefly. If you follow the, you know, video, you kind of see how that expands upon, okay, this was enacted, here's the results from it, here's where we're at now in steps. There's always challenging issues within public health. You know, public health, there's a lot of coordination, there's a lot of collaboration with the public health within a lot of healthcare entities that don't traditionally collaborate well. There's certain things in healthcare that we do very, very well, but we do them in silos. You know, public health and epidemiology is one. Population health management is one, but it's slowly becoming one that we're getting out of the silos. Things such as, you know, the integration in terms of collaborative care within pharmacists, outpatient providers, you know, diagnostic services, and those key public health services. You know, when we're looking at things like disease states and vaccines, you know, bacteria, those certain things that can have a public health impact. Those are, you know, some key aspects. If you look at Zika, you know, Zika's in the Ebola scare of 2 years ago. And if you look at those and you look at the challenges and the disconnects, it will help you a lot within this discussion, because we're still seeing those same silos create some disconnects that help to make our public health system lag a little bit in terms of response to certain things. What are the advantages do you see in the domain of public health now that ACA has been passed? What challenges do you see in the domain of public health now that ACA has been passed? So we're looking at a two-fork road there. So when you look at this, there's a lot of resources out there on this. There's a ton of research done on it. If you're going to research it, look with an ECPI library first, and then use a great tool called Google Scholar. Okay, do not use just Google on this. Google will bring you up some ridiculous resources, especially if you're talking about the Affordable Care Act. It's going to bring you up some very, very biased sources. Use Google Scholar. Google Scholar will bring you up only peer-reviewed sources. That is what we want from an academic, scholarly perspective. That is what we want, period, when we're researching within healthcare. We don't want to go off of what Dr. Oz is recommending, even though he's a doctor, he's got his own interests. We don't want to go off of what some organization says is, nevervaccine.org says. We want to look at the peer-reviewed, substantive research, things that were designed, controlled, looked at, and done with an unbiased viewpoint. And going through Google Scholar is going to get us those. Going through the ECPI library is going to get us those. Very, very key to look and use those sources appropriately when you're answering that question. This is one that I will caution you to make sure you're using peer-reviewed sources, because you are going to get all kinds of, to put it as best I can, garbage regarding this if you type it in just a regular Google, especially now with election season. So look to use those peer-reviewed sources. There's going to be a ton of information on the web with this. Why is it difficult to manage public health at the local, state, and federal levels? My hint to this is look at coordination. Coordination is very, very key. Coordination and communication. Coordination and communication should be a central focal point here. Make sure you're backing these things up with references. I know a lot about public health. I know a ton of information. I could belt out a paper on this pretty quick. But it's not common knowledge. It's common knowledge to me, but it's not common knowledge to everyone else. Common knowledge would be who's the president, is the grass green, is water wet? That's common knowledge. Those are very, very easy things, things that you would expect everyone to know. When we get into these sorts of things, it's not common knowledge. So if we're giving particular facts and information, figures, statistics, all of that, we need to have substantive sources for them. We need to have references that back those up and back up our perspective. That's where those references, those peer-reviewed references come in. We need those. We live and die by those within healthcare. Every one of the treatment decisions, the drugs we, prescribe, the care processes that we use within, nursing homes and acute care facilities, those are all based upon evidence-based practice, research, fundamental research that we're referencing back to and providing the best available care from the best available research. So we want to use those same approaches within our discussions. And even if we're responding to our, fellow peers, it's always a good thing, to critically assess their posting and ask some key questions. Use some references to say, hey, as stated in so-and-so, their viewpoint was this. What's your perspective on this, given that your initial posting stated this? That's how we all learn. Those are great discussions. That's what makes things great. The discussions within the online environment is where an immense amount of learning occurs. It's just a beautiful thing. So make sure you're engaging your peers. Very, very key aspect. It's something that I look for when I'm grading your postings. So make sure you're engaging and critically appraising and asking key questions to your peers when you're responding to them. And then likewise, make sure if they're posing those questions to you, that you're engaging within those questions as well too. Now, our Unit 1 assignment, we're looking at the epidemiological surveillance. When we look at the epidemiologic, I couldn't get out the word, surveillance, a system that compels a specific notifiable diseases must be reported to help detect epidemics in the early stage, allowing measures to be taken to curb the spread of infectious disease, aka reportable diseases. These are things that we must report to the health department. Coming from a laboratory background myself, we have certain tests that if they're positive, we have to report them to the state, whether it be, say, like salmonella, or whether it be, certain STDs, whether it be things like MRSA, things like that, that we have to report to them so they can track from a public health perspective. Because sometimes we may have these little pockets of these conditions that, say we have a case of measles or mumps, that's reportable. So these occurrences are what help us track certain outbreaks, certain blips of activity, those types of aspects, how we help manage those, how we help respond to those, how we help develop legislation to address those issues. Whether it be from Lyme disease within Connecticut, they have legislation in place to help target Lyme disease because that's where it was discovered, old Lyme, Connecticut. And guess what? I used to live there, and I got Lyme disease when I lived there. So they have certain legislation targeted towards that. While most hospitals have response plans to the potential Ebola infections from workers coming back into the country, or for other reasons, there were certain states and certain areas that had a different level of response because of the potential likelihood. There were different levels of hospitals that had a higher echelon of response because they were designated within their state as being the primary isolation hospital because of the facilities they had. So these are all some different things that we focus on and take into account when we're surveilling aspects. So when we look at this, the instructions here are: research a current infectious disease outbreak or choose a historic one. Legionnaire's disease, E. coli, things like that. I would encourage you to use a recent one. Take, for instance, Zika. We look at the Ebola aspects. We have some outbreaks of, mumps and measles throughout the U.S. because of the vaccination issues. We have Lyme disease aspects, hantavirus, dengue. We've had some issues with those as well too. Those are all recent because you see a modern response to those, which is going to be helpful within this course, probably better than looking at the Black Plague. So look to those aspects, and I would just advise you, to try to keep it recent. You're not going to get any points docked if you don't keep it recent. It's just going to be more, beneficial and enlightening to you from a learning perspective. You're going to summarize the steps taken to identify and curb the outbreak, and then evaluate the effectiveness of the interventions or actions taken by the public health officials. So, you can find a lot of information in terms of state-by-state responses, regional responses. CDC.gov is going to be a good resource for you guys to use on this, especially when you look at evaluating the effectiveness of the intervention or actions taken by public health officials. CDC is going to have a ton of statistics. They're going to have a ton of statistics as a nation and state-by-state. Your local health department may be a great source. So if you go, for me, I'm in Indiana, so I think it's Indiana Health DEPT.gov or .ind, something like, or .ind.gov. So that's a great one. So you look at your state health department. They're going to have a wealth of information for you on a lot of this, as well as CDC.gov is going to have a great wealth of information. And those are peer-reviewed sources. These are what we call valid sources. They are governmental agencies that are expert bodies. They have expert opinions. So if we were researching cancer, which it wouldn't be for this assignment because it's not an infectious disease. But if we were, say, researching cancer, the American Cancer Society would be a great resource to use, a great reference. So, for this one, we can look at cdc.gov, we can look at NIH, you can look at your state's health department, you can look at the WHO, which is the World Health Organization. They have an immense amount of information, not only within the U.S., but across the world in terms of these responses, because that's a large part of their job. I've worked with the WHO within, within some different areas on not within infectious disease, but within population health management. They have some immensely impressive people doing some great things within the public health sector. That's just amazing. So they're a great source. And look to address those questions. Make sure you use references to back that up. Make sure you're using the proper APA. And if you need help on these, let me know. Reach out to me. I'll be posting a few things throughout the remainder of the week to kind of help you on this. Maybe some sources to ID some potential things to write about. So look for those throughout the week. You'll see those pop up probably Wednesday or Thursday. I know a lot of you do your work on the weekend because that's what you have available. I went to school and worked full time and had a family, as well as I worked a few other, part-time jobs for my bachelor's, my master's, as well as my doctorate. So I know how hard it is. I know how hard it is to carve out time, excuse me. So a lot of what you're using is going to be on those weekends. But, the best thing, is time management. That's going to be key with this course because we're going to be covering some newer topics for you. We're going to be looking at things in a little bit different light than what you may be used to. So make sure you're using good time management. And if you have any issues in terms of late submissions and that, communication is the key. So, just make sure you're reaching out to me. That is what I wanted to go over for Unit 1. I'm going to go ahead and pause the recording right now and then mute my mic. And if anyone jumps on, I will go ahead and turn everything back on and answer the questions, and we'll go from there. All right, you guys have a great rest of the week. I will be in contact. You will hear from me. You'll see some things pop up within the course room that may be of help to you as you're formulating your plan and your topic for the first assignment. And I look forward to working with you all. All right, you guys take care and have a great night.